What if I told you that exercising the wrong way could spike your blood pressure and undo months of medical therapy, even put you at risk? Many patients and even therapists mean well, but commit silent, dangerous mistakes when designing workouts for hypertension. Mistakes that cost many lives. Stick around. In the next 15 minutes. I'll show you exactly what not to do and how to turn your exercise plan into a safe, powerful tool to lower blood pressure, not even to worsen it. If you are someone with high blood pressure, or you are a therapist or a trainer working with hypertensive clients, let's dive in. Now, why this matters? First, we do care so much because exercise works, but only if done right. Studies show that moderate intensity aerobic exercises can lower resting blood pressure by 5 to 8 millimeters of mercury on average in hypertensive individuals. In patients resistant to medications, a 12-week moderate aerobic program reduced 24-hour systolic blood pressure by around 7 millimeters of mercury compared to the usual care. But with that potential comes risk if you don't respect the physiology. That's what we'll address: the mistakes that convert potential into peril. Let's go through the top mistakes you must avoid when exercising with hypertension, and then I'll show you safe, evidence-based guidelines you can use. Mistake number 1, skipping medical clearance and the baseline evaluation. So mistake number 1 is assuming you can just start exercising without proper screening. Whether you are a patient or a therapist, never skip this. High blood pressure often coexists with other risks, such as heart diseases, kidney issues, vascular problems. You need a baseline ECG if indicated, baseline resting blood pressure, the medications, and risk stratification. Therapists get medical history, the medications, especially the beta blockers, the angiotensin converting enzyme inhibitors, and any contraindications. For the patients, be honest about symptoms such as chest pain, shortness of breath, fainting, and if BP is severely elevated, e.g. more than 180 systolic or more than 110 diastolic in some protocols, that's often a red flag to delay exercise until control. Do not start with clearance. Once clearance is established, the next big mistake is mistake number 2 is going too intense and too soon. Mistake number 2 is charging into high intensity before your system is ready. This is common. Someone with hypertension eager to get results jump into high intensity training, sprinting maximal intervals. But hypertensive individuals often have an exaggerated blood pressure response to exercise. That is exercise hypertension, meaning their systolic pressure rises excessively during exertion. Pushing too hard too early can provoke dangerous surges, arrhythmias, or vascular stress. Instead, start with moderate intensity, e.g. brisk walking, cycling, low impact and build gradually. Evidence suggests that moderate intensity training is more effective for blood pressure lowering than going extreme. Mistake number 3 is ignoring blood pressure responses during exercise. Mistake number 3, you do the workout and never check blood pressure responses mid and post session. That's blind recklessness. You must monitor blood pressure, heart rate, perceived exertion. If systolic blood pressure climbs above safe thresholds, this depends on the patient's age, medications and risk, you need to dial back. Also look out for symptoms like dizziness, chest discomfort, excessive fatigue or headache during the session. Some guidelines suggest that a systolic blood pressure of more than 210 millimeters of mercury during exercise in men or more than 190 millimeters of mercury in women may be concerning. For the therapist, build into your protocol shot. Build into your protocol shot and do BP checks or use wearable monitors in high-risk clients. Don't proceed blindly. Mistake number 4 is neglecting warm-up, cool-down, and abrupt transitions. So skipping or doing a weak warm-up and abrupt stoppage, that is a mistake. That's a recipe for blood pressure spikes. Warm-up primes your vascular system, gradually dilates vessels, and prepares the autonomic responses. Likewise, a proper cool down helps bring down your blood pressure gradually. Jumping from intense exertion to complete rest or stopping suddenly can cause rebound pressure changes or blood pooling. Always begin with the 5 to 10 minutes of gentle movement. Is overemphasis on heavy isometric or maximal lifts. So overdoing heavy isometric or maximal lifting is a mistake. These exercises, that is heavy static holds, plank holds, heavy leg presses, can provoke large spikes in intrathoracic pressure and abrupt blood pressure increase or surges. The evidence around isometric resistance training is still insufficient to universally recommend it for the hypertensives. That doesn't mean resistance training is off limits. Dynamic resistance, that is with proper technique, moderate loads, and controlled tempo, is beneficial and safe when introduced progressively. The key is avoiding Valsalva maneuvers, heavy lifts near failure, or sustained maximal holds. Keep repetitions moderate, rest between the sets, and always monitor the blood pressure and symptoms. So some of the bonus pitfalls and special cases, a few other mistakes and caution zones to watch out for include: number 1, we have uncontrolled hypertension. That is, if resting blood pressure is still very high despite medications. Exercise may need to be delayed or extremely cautious until control is better. So number one is uncontrollable or uncontrolled hypertension. Number two is concurrent conditions. People with coronary artery diseases, kidney diseases, cerebrovascular diseases, or stiff arteries may have less margin of error. Then number three is medication, interactions, and timing. Some blood pressure medications blunt the heart rate. That is, for example, the beta blockers. So using maximal heart rate zones may mislead, and always interpret in the context. Then number four is ignoring recovery or overtraining. Too much volume with inadequate rest can raise sympathetic tone, stress, and undermine the benefits. Then number five is lack of individualism. What's safe for one hypertensive patient might be too much for another, and the therapist should adapt based on age, fitness, comorbidity, and medications. So, guidelines and safe protocols. Now, here's what you should do: a safer, evidence-based approach. So, you should start with a moderate aerobic exercise on most days. That is 30 minutes per session or accumulated bouts, plus 2 to 3 sessions of dynamic resistance, that is moderate loads per week. Then do continuous or accumulated bouts. Do continuous or accumulated bouts of 10 minutes rather than pushing extreme intervals. Warm up and cool down of 5 to 10 minutes each. Then monitor blood pressure, heart rate, rate of perceived exertion, and adjust intensity if blood pressure climbs too much or symptoms occurs. Increase intensity or volume gradually, e.g. 5 to 10% increments per week, depending on the tolerance of the patient. Then use dynamic resistance, that is machines, bands, moderate weights with controlled movements, and avoid Valsalva. Rest days and recovery are integral. Then reassess periodically the blood pressure trends, the symptoms, and the interventions. If you are a therapist, work closely with the patient's physician, regularly share the blood pressure trends, adjust protocols, and always proceed conservatively in high-risk clients. Then a mini case study. Let me share a quick story. A patient, Mr. K, that is aged 65, started a boot camp style class despite having stage 2 hypertension. At his first session, he collapsed. His systolic blood pressure had spiked dangerously, and after recovery, his therapy was switched to a gradual walking plus resistance program. Over 12 weeks, his blood pressure dropped around 10 millimeters of mercury without incidents. The difference is he avoided those 5 mistakes: no medical clearance, no intense too soon, no monitoring, skipping warm-up and cool-down, and heavy isometric loads. The transformation wasn't luck, It was respecting physiology plus the SAFE program. So to wrap it up, the key takeaways are: don't skip. Number one, don't skip medical clearance. Number two, don't go full throttle too soon. Number three, always monitor responses and don't fly blind. Number four is warm up and cool down. Then number five, avoid heavy static or isometric overloads early on. So when done right, exercise is medicine, a powerful evidence-based tool against hypertension. But used wrongly, it can backfire. So if you find this helpful, like, share. Thank you. Similarly, with lower intensity and stretching or ligament